Uh, Thank you, sir. Thank you to Dr. Umesh Khanna, sir, for inviting me, and to Dr. Nikhil for introducing me to sir. And yesterday, everyone started with a disclaimer saying they're not a biostatistician. I'm not even a nephrologist, and not even an engineer. So, introduction, I don't know, sir. So, yeah, I was telling Dr. Siddharth that I am a dabbler at best. So tech has been a hobby and passion since childhood. Good marks in 12th standard plus doctor parents equal to an MBBS as an undergrad. So that's what happened. So parents were doctors, got good marks in 12th, so became a doctor. And at some point felt that I love math too much. So went ahead and got a MBA degree, coexisted with engineer friends from then on. So yeah, that's a brief background. I thought before I get into the presentation, I'll just show you like a couple of things that AI is already doing. So what you see on screen is a typical AI tool. This is not something very special or even paid. All of you have access to this. We'll talk more about this. This tool in particular is ChatGPT. It's available as chatgpt.com. And this tool is Claude. Claude is a peer to ChatGPT. So both are what are called as generative AI tools, and we'll talk a lot more about them. But this is, so I took permission from Dr. Srijit yesterday. So I had actually taken a photograph when he was presenting. And so I just uploaded this photograph into Claude. And so I just asked, what's happening in this image? Can you explain in detail? So the answer was that this image is a medical research presentation, event details, Sofitel, what's going on, venue, sponsors is ever vital. So this is just, just take a photo, upload, and then I said, no, but, I want to understand more about the data in the tables. I didn't want all this peripheral information. Tell me what's happening in this image. And so it says, okay, sample size 266, living recipients 172, deceased recipient 94. I'll jump to the conclusions. So it said living donors tend to be older than deceased donors. There's a gender disparity between living and deceased donors and recipients, and so on. Just proving a point here. So yeah, it's very much here, and it's very easy. And the rest of the session, I was telling Dr. Siddharth, this is almost heretical after what we've had for 2 days. Nothing is undermining the research process, but I'll tell you where we can use AI and where we shouldn't. There was another interesting thing I did. I mean, it's more fun to do these things. So I just asked this question. What's common to IVO, ideal ICU, and Euphrates? Sir was talking about it. So it said, I'll need to analyze, and they are all names of clinical trials in intensive care unit settings, all of that. It didn't get the answer immediately, so I said something regarding sample size. It says, thank you for the additional hint. You're right. It says they were all stopped early due to futility. And then specifically, IVOR was stopped after enrolling 140 patients out of a planned 160, and Euphrates was stopped after 450, and so on. So this might make you feel AI is very intelligent, but we'll look at it in the presentation that it's actually as dumb as it is, and being dumb gives it all the power. So I'll explain what I mean by that. So I thought I had to use those two examples to give credence to this. Lenin said that sometimes, there are decades where nothing happens, and then sometimes there are weeks when decades happen. In 2022, 2 years back, around 30th November, ChatGPT was launched. And in a couple of weeks, decades happened. So this is a chart which shows how long different popular apps that we know today took to reach 100 million users. 100 million is 10 crore users. Spotify, so Netflix took 10 years, Airbnb, Twitter, Facebook. TikTok took 9 months. ChatGPT took just 2 months to get to 100 million users, and that's just testament to the sort of power that it has brought. In terms of just giving you some quick snapshots of what AI is doing today beyond the fun use cases. So this was, AI versus 5,000 engineers, and it outperformed 5,000 engineers in a coding test. Microsoft has this new AI which needs a 3-second sample of your voice to fully replicate it. It's just a 3-second sample. Then you give it a sentence and it'll speak in your tone, diction, mannerisms, everything. It has cleared the USMLE and the Wharton MBA at the same time. And after clearing, it also correctly diagnosed 87% tumors in 15 minutes compared to 64% in 50 minutes. So yeah, things have started happening. It's better, it's equivalent to dermatologists in identifying skin cancers, better in people of dark skin. It can predict risk of suicide. Ironically, the one edge that we humans had of being human, it's even better than us at that. So it's better than doctors in empathy, and which is so weird. A system is better than us. So yeah, it's this is AI today, so all powerful. I introduced myself. I did my MBBS, then went to do an MBA, moved out. Have been in consulting after that, and for the last 10 years, I'm building this platform called Netflix. Just a few terms before we get into the session. So technology. So technology is the thing behind all these tools. So what we just saw, Claude and ChatGPT, they are tools, and there are many tools. We'll look at least 3-4 tools today. But the technology behind them is what you have machine learning, neuro-linguistic processing, LLMs, all of that. We are not interested in that as the scope of this discussion. This is what hardcore researchers and engineers are building. Tools are the applications of these technology. Use cases and prompts are what are most important to us. So once you know that, okay, ChatGPT is a tool, Claude is a tool, but what are the use cases? How do I use them? What do I use them for? And prompts is the language which you will use to get the tool to work for you. So when you had Google, you had search queries. On PubMed, you built queries. On AI, you write prompts. It's just a matter of syntax as such. But yeah, they are called prompts. So, AI has been there for a long time. It's been there since 1950s. It's definitely not a new thing. What is new is generative AI. Generative AI was in the works for the last few years, was released in 2022 by OpenAI, the company which built ChatGPT. So generative AI is, it refers to deep learning models, the technology behind them, that can generate very high quality text, images, and other content based on the data they were trained on. Just a definition, good to know. Large language models, so we'll just take 30 seconds to explain how the large language models work. It's essentially an algorithm, so think of it as a software which someone built. And then you train that software on 10,000 pieces of information. So you show it 10,000 photos of a dog and say dog, dog, dog. And then you show 10,000 photos of things which are not dogs. And you say not dog, not dog, not dog. Then when you give it a photo, it'll tell you whether it's a dog or not. This is the crux of the training which happens for the large language models. So only that in the case of large language models, as the middle L says, it's language model. So it's trained on, I don't know the number, but like billions and billions of gigabytes of data, which makes it very powerful. And what data is it that it's trained on? This is all possible data that they could scrape on the internet. So this is obviously your entire PubMed. This is everything, but there's also a lot of non-credible data. So they trained it on Instagram content, on Reddit content, on anything, all blogs that were accessible to them. So a lot of books also. So this is what also makes it prone to mistakes, and we'll also see an example of that. So moving on, what is ChatGPT? It's a chatbot. We just saw Claude, but Claude and ChatGPT are the same. So they are chatbots. You go to them, it's a conversational interface. There's a box, you type something inside. There's an answer. So unlike Google, so Google is not conversational. You put a query, it gives you results. You click on the result and you go about your work. With ChatGPT, it's conversational, which means you put a question, it'll give you an answer. Then you ask a further question, it understands that the context of the first question. You can go on as far as you want. That's what makes it really powerful. It enables ongoing conversations and builds upon previous results. In terms of the role ChatGPT can play with you, it could be like a personal secretary. It can take care of a number of repetitive things that you do. It's very creative. Its power comes a lot from its creativity. So ask it to write a poem, ask it to explain dialysis to a layman in a simple language, or ask it to crack a joke. The creative power is substantial. It can also be a great sounding board. It can help you think through the research problems. It's a great analyst. It analyzes data. In example we saw, it's extremely good at translations across languages. It can be a teacher, but it is not sentient. This is what I meant by saying, it's not intelligent. It has zero intelligence. It's not like it has zero intelligence. It does not know what it is saying. ChatGPT or any other generative AI tool simply works on probability. And the probability we say is the probability of the next alphabet which should come. So for example, if I ask this room, randomized dash dash, you're going to say clinical trials. You've learned, and you know that randomized is always followed by clinical. This is exactly how generative AI repeats or creates content. It has been trained on so much information that it knows that when I say what the dog dash, the fourth word has to be saw. That's a book by Malcolm Gladwell. So it knows that when I say what the dog dash, the next word is going to be saw. It's fully probabilistic, and there is no intelligence. So even the analysis it did of that image, entirely probabilistic, and this is very hard for us to fathom, understand, and people who've built it are on record that we don't know how it works. We don't know how it works, like how it's able to actually come up with such sensible answers. We know the science behind it, but in a particular solution, I don't know how it went from this question to this answer. So they don't know how it works, or they don't want to say. That's a big conspiracy theory that's there. Alternatives to ChatGPT, Claude, Gemini, there are many. These are the powerful ones. Gemini is the tool which was built by Google. Claude is built by a company called Anthropic, which is supported or backed by Amazon. And ChatGPT is built by OpenAI, which is backed by Microsoft. So these are the big guys. And not to be left behind, Facebook has created Meta. The good thing so there are specific advantages of each tool. The advantage with Meta is that it's inside WhatsApp. Most of you would have access to this inside your WhatsApp thing. And the area where Meta excels is personal experience. It's great at current news. So if you ask it something about Vinesh Fogart today, it will give you a far more sensible answer than any of these guys can. So these are different tools are getting better at different kind of things, more strategic about how the company wants to position them. Since Meta is inside WhatsApp, it makes sense for it to be very news oriented. So let me let's quickly do this and see how the tools work. I'll copy. I have this prompt so that we don't waste time. Yeah, so there is this prompt which says, can you list the most recent clinical guidelines in CKD, Indian American and European? You can be the best judge of the quality of answers. So I'm going to type this. So when you go to any such tool, you're going to have a chat box, which is where you put the prompt. What we've put in is the prompt. Can you list the most recent guidelines in CKD? And you just ask the question. We'll do the same thing with ChatGPT. For the sake of clinical questions or literature questions, Perplexity is one of the better tools. You can note it down. It's called perplexity.ai. Amongst these different tools, as far as literature is concerned, Perplexity is one of the better tools. You also put the same question there. So I look at Claude's responses first. Yeah, so these are the guidelines that it has identified. I am not sure if these are right, wrong. The thing is, generative AI is all about conversations. So the follow-on questions really make the answers better. So if anyone would want to have a follow-on questions, if there's a mistake, you can say this is not right. Or if you want to go deeper into, see, this is an example of is 2012 the last guideline? It can't be, right? So yeah, so. So you just say, so it's very quick to apologize. It's very quick to agree, and it's not very reliable. And therefore I always say that the golden rule of using GenAI is to use it in your area of expertise. Do not never use it in an area where you're not an expert, because you're most likely to be misled then, or you will never know when you're being misled, because this what just happened is called hallucination. It's a real word with GenAI, so it hallucinates. It just gave you an answer, and there's an even better example of hallucination we'll see again. I'm not sure if it will be replicable, because generative AI, unlike Google, is not replicable. Every time you ask a question, it starts from scratch. So I've had this typical mistake, and I don't know if we'll make that mistake again, but it hallucinates. And therefore, it's very important for us to use it more as a labor-saving tool rather than as an intellectual tool. To the extent it helps save time, to the extent it amalgamates content from different places, it's great. But to use it in an area where you don't have a clue is very risky. At this stage, the tool is not at that level, and which is also a reason why these tools are not FDA cleared or for clinical care, or they are not even allowed to be used in a lot of places at this stage. ChatGPT's answer was this. Yeah, it started with 2022, and the lengths of their answers will vary. We'll see Perplexity. The advantage with Perplexity is that it gives you more questions to ask. So it actually guides you along your research. So it says now you can ask this, and if I click on that, then the conversation goes along in that direction. So this is just an example again. Similarly, you can do more examples. Can you share the 5 most recent clinical trials or things like that? I'm going to try this. So let's go to Claude. Saying, can you provide a summary of the following trials in nephrology? These are just names I picked up over the last 2 days. It'll do a decent job. And again, the power of the tool is in the follow-on questions you'll ask. You say, okay, what were the endpoints? What were the limitations? And those answers are really good. So you say, what were the limitations of Mentor? So that is that. But now I'm going to insert a trial which didn't happen, or at least didn't happen in nephrology. Yeah, so it'll make it up. So this is dangerous. This is proper hallucination. Yeah, you've got to be careful with this tool. It's right most of the time, but when it's wrong, it's equally confident, and so that's a problem. So yeah, let's see. I would hope not. Yeah, I didn't give Trinity. Oh, I didn't. Oh, I yeah, but so if you'll search for this will be some different trial. So last time I came across something called Nobility, which was called as Trinity. Then there was a Duet, which was called as Trinity. So the thing is, this is 2 years old in public domain. There's a lot of development happening, and a year from now, maybe 6 months from now, these mistakes will keep reducing. But it's very pertinent to say that today we are at this stage. Maybe the way the models are trained and fine-tuned, they are not trained and fine-tuned enough to say no. They're not fine-tuned enough to say this seems to be wrong. They're trained to take things on face value, because the majority of the people are not trying to break the system. We are just doing this to make a point, and which is why if you are a nephrologist, you're never going to put Trinity inside. Most of the time, the answers are going to make sense.
In ChatGPT, can you insert a picture?
Yes. Yeah.
Can you just demonstrate this? You showed it in Claude.
We can put a picture. Let me see if I have a picture. Actually, I'll show you an interesting picture. I'll show you the picture first. So you'll appreciate. So this is the picture we are. So this is what we are inputting, and we'll just say, can you? Oops, sorry. Can you help read this? Actually, ChatGPT will, yeah, so.
But it says in Hindi, in English.
So there's some things in Hindi, but yeah. I mean, it's impossible to say whether it's hallucinating or right, because we can't read the prescription. We'll have to find the real author to see, but at least RL looks right. So.
Most of it is right.
Oh, you can read it? So yeah.
First 7 are correct. First 7 are correct. The 8th one I'm not sure.
I love the confidence that you have in this handwriting. So yeah. So quick word on limitations and ethical considerations. So first is, we discussed this accuracy and misinformation, definitely a real thing at this stage. Second is, when you upload these things, patient data privacy and your institutional privacy. These are two things to take care of. If you upload things, crop out or delete personally identifiable data. Just a word, don't don't paint out information. So for example, if you have a file, you'll put a white box on it. It's smarter than that. It can read content behind a white box. You'll actually have to crop out. You can't put a box. Fourth is disclosure. So if you've used AI in your research or especially in your writing, it's a good practice. Yesterday, I think we saw a couple of journals which make it mandatory. I think it's a good practice to disclose, and sometimes it's mandatory to disclose. Fifth is a very big issue which we are going to see in the next 10-20 years. It's so useful, so powerful, so addictive that there's a real chance of people becoming less intelligent over time. It's something which I personally believe that policymakers should maybe ban people below a certain age from being allowed to use it, because for a lot of us, our foundation has been built. We've learned things. We'll now use it. We understand the differences. For a lot of people, they are going to enter into this right away. They'll never build the foundation of a p-value or sample and population, and they'll go directly here. They'll get all the answers. So this is a big issue. And finally, copyright infringement. There's a very big controversy around OpenAI team using paywalled articles for training their content. So you will get answers on paywalled articles here. And there are multiple lawsuits going on as we speak. Second is originality. So if you submit something which you've not written, I think that's a gray area. It's not plagiarism because you're not copying someone. It's generated by AI for you. It's not plagiarism, but it's not yours either. That's a gray area. And unintentional plagiarism is a big issue. So a lot of times what ChatGPT or Claude will throw out is somebody else's content verbatim. You will not know that you have copied it. You believe that it's original because it's come from a tool, but it's actually found to regurgitate exact blocks of paragraphs from someone else's content. And so you become, a victim of unintentional plagiarism. These are some things to worry about.
Tell you if you ask?
Yes, but you'll have to ask paragraph by paragraph. And so you put in a paragraph and say, is this sourced from anywhere else? But how much can you rely on it is a question mark. So like a positive hit is a positive hit. But if it says no, then are you sure that that's the right answer? So quick difference between Google and ChatGPT. I'll pass through this. But one, ChatGPT is about ongoing conversation, about threads. It actually gives you the answer. Google gives you the raw materials. It'll give you 30 or 3,000 sources, but you will have to do the work. ChatGPT gives you the answer, and it really appeals to the human laziness, which explains the jump to 100 million users in 2 months. It provides the dish straight away. Also, in ChatGPT, the human effort is free. What we mean is that the better the prompt you write, the better the answer is going to be. On Google, we don't waste more than maybe 5 to 10 seconds in writing the query. But on ChatGPT, if you will spend maybe at least 5 minutes drafting your prompt, it will give you significantly better answers. Can make big mistakes. Google does not make mistakes because Google does not give answers. It just shows you the way. It might link a false blog, but it's not Google's mistake. It's that blog author's mistake. Whereas ChatGPT is actually giving you an answer. So to write better prompts, these are just some general rules. Keep 5 things in mind. So when you prepare a prompt, give it context, as much context as you can. So things like so if you want to, let's say, create a presentation outline, then the context would be who's going to be my audience, or how long is the presentation. So that's all context. So give it as much context. Think of these tools like a research assistant. If you have an RA, you're going to give that person a lot of context. Like you can't just give a one line, because if you'll give a one line, you'll come back with something not entirely right. Second, allow it to adopt a role. So you say you are a trained nephrologist with 20 years of experience. So that is very important. It gets in character. Third is output. So on output, you can specify whether you want long or short, whether you want 100 words or 1,000 words. You can specify whether you want a casual tone, a persuasive tone, a sarcastic tone. So, express yourself. And you can also specify whether you want the answers in a table format, in a list format, in a flowchart format. Flowcharts are not very good, but you can specify style, you can specify length. But so this is how the prompt is constructed, but post the construction of the prompt and the first iteration, give it feedback. So once it gives you the answer, give it feedback. Say, this is great, but I don't agree with this part, you could curtail this part. So talk to it. That's where the answers get refined really, and keep experimenting. So this is an example of a prompt. So if you want to deliver a lecture on a topic, it's not simply saying do this lecture. So it is, you're a senior nephrologist with 25 years of experience practicing in Mumbai. And this all allows it to contextualize the answers to, maybe there are things specific to your region. So that's the role. Second is lecture on managing CKD in pregnancy to an audience of trainee nephrologists. So I'm not doing it in an MBBS class, I'm doing it in a DM class, and the answers will definitely be different if you change that word. So that's context. And then the output is, it's a 20-minute talk, exclude irrelevant details, focus on practical implications. So what? This is just me, blabbering to it. All of this is not necessary, but the more you write, the better the answers generally come. Right, so this was more of an introduction. How much time do we have? Yeah. Yeah, so this was part one. I wanted to talk about AI in general.
We can continue those who want to. We can continue.
I'll show you. So we've seen perplexity. So so the research process you all know. So there is background research and review of literature. There are two apps for that, Heuristica. I mean, there are a lot of apps for that, but there are two which we would have seen. But I'll skip this one because perplexity we have seen, and Heuristica is more fun. Rather than useful. So, at the end we'll check it out, or just go to Heuristica website and see their video. ResearchKick is interesting. So, it helps you to generate research ideas and refine your research problem. And it also helps to check if the problem that you have now identified has been adequately addressed in literature or not. So, it's pretty useful. The third one is also useful, Research On. It's used for building protocols and building questionnaires, and also drafting your manuscript. The fourth is analysis and insights to analyze your data. And the fifth is again manuscript drafting and presentations. So ResearchKick is a paid tool. It costs about 750 rupees a month. The way I would look at it is, I would take it for a month when I'm figuring out what I want to do. And discontinue it afterwards. So that's okay. Research On is also a paid tool. For one study, average cost is going to be about 3,000 rupees, 4,000 rupees. Most of these tools, so ChatGPT and Claude are free. So they have a free version. ResearchKick and Research On don't have a free version. But ChatGPT and Claude, the free version is good enough if your usage is not heavy. If your usage is heavy, as a thumb rule, all these tools are $20 a month. ChatGPT, Claude, Perplexity, Gemini, all of them are at $20 a month, which is roughly 1,800 rupees a month. Depending on your usage, this may be completely worth it or tad expensive. So it really depends on usage. These prices probably are coming down, but I'm pretty sure that in 6 to 12 months, everyone will as default have at least one tool that they are subscribing to, because they are very powerful in saving time. So before I go to the tools, this was one very powerful use of AI.
What is the edge that the paid version gives over the free one for ChatGPT?
So ChatGPT, the current powerful model is called 4o, and 4o is available to free users, but after a certain amount of usage, it brings you down to 4, and you'll never know that. So the quality of responses will become poorer after a point. Same with Claude, their default version, the best version is 3.5. It's called Sonnet, 3.5 Sonnet. So if you want 4.0 forever, like for every conversation, you need to pay. If you want 3.5 Sonnet for every conversation, you need to pay.
So all of these GPT tools, we need to download the apps on the phone when we use them?
You don't need to. They are on the web, so you can use your Chrome or Safari on phone.
They don't remember you if they are on your phone.
They will remember you because you'll have to log in. So even if you go to Claude.ai, you'll have to create your account first. Once you have created your account, it will remember your conversations and everything.
Cloud is free, no? Cloud is also free.
Yeah, Claude and ChatGPT both have free versions, and the free version will give you a decent experience. So yeah.
If you improve an answer by asking any questions, does it use that and for everybody else's questions?
Yes. So anything you do on any of these tools, the information is going to train the model further, which is why it'll keep getting better, and which is why we have to be careful about what we share. ChatGPT has a mode called temporary chat. So ChatGPT has a mode called temporary chat, which is like incognito for Google Chrome. So when you turn on temporary chat, for the period that's turned on, your content will not go out. So you could use it intermittently. So there is this company called InSilico. They actually have their own internal. They created their own AI called Chemistry 42, and Chemistry 42 is like ChatGPT but for molecules. So what they were looking at was to create an novel molecule that will help with IBD. They figured out that we want a molecule which reduces the expression of PDH, and so that's a receptor, and the model came up with 1,000 combinations of carbon, hydrogen, oxygen, and nitrogen, and these don't exist. The model is saying these 1,000 combinations will suppress PDH, and then they gave it more constraints. They said I want oral, so 1,000 became 100. And then they gave it more constraints, and finally they came with this one molecule ISM 5411, which meets all their constraints. They have now synthesized it, and this is now in phase 2 trials. So when this comes out, this will be an entirely AI generated molecule.
Does ChatGPT has any truncation?
As in?
Like truncation that research we use, inverted commas or something.
I didn't get the question, sorry.
Suppose
So-
if you want to have some information specifically, then is it something
Oh, okay, like emphasis.
or inverted commas?
Yeah, it does. So it does understand those things. So if you'll put things in inverted commas, it'll lay emphasis on that. But it's not as clear as Boolean. It's not going to, this does not work like search. It's going to give an answer. It's not going to show results. So if you will say, but it's more conversational. So you can, instead of not and or, your language will take care of it. So you can say, give me papers from BMJ but not from NEJM. And it'll understand that. It will not give you NEJM papers, it will give you BMJ papers. So it's, in a way, it's a step forward from Boolean in that it's very natural language. But in a way, it's not harsh. It's not as rigid as Boolean is. So yeah, so that was one. We'll skip this. I'll show you ResearchKick and how it works. Yeah, so ResearchKick looks like this. You need to say what's your research project about. Anyone? But that was more of review of literature. Let's say if you want to publish a new paper, if you've been thinking, if anyone has been thinking, just keywords. And the idea here is two things. One is to refine the problem. So you start with a general idea. It'll help you refine the problem. And two, do a literature match. That has this problem been, like, will this be an original contribution, or has it been answered adequately? So any example?
Any topic. We can say use of a white noise machine to improve sleep. So can you use a white noise machine to improve quality of sleep?
Can we use a nephro example so that, like, it's probably more because it'll give you 15 options, and to, like, appreciate the breadth in which it thinks, it'll be much more appreciable. It's in nephrology.
CRRT versus continuous renal replacement therapy. CRRT versus peritoneal dialysis.
That's it.
In critically ill patient.
MBA. Okay, fine.
So here you see that it's given me 4,700 credits. So every month you get 10,000 credits for that 750 rupees, and some credits will be deducted. Now what it does is it looks at the query you gave from 15 different angles. So this is a more, it always starts with a more molecular angle. So there's one way to answer, draft this research. What are long-term outcomes on renal function in patients with CRRT compared to those with PD? This is probably closest to, like, what a normal question would be. This looks at inflammatory response in cytokine profiles. This looks at cost effectiveness and resource utilization differences. This looks at timing of initiation of CRRT, electrolyte and acid-base balance, complications, and so on. So it will give you 15 ways in which you would want to look at it. Shall I choose the second one, which was the broadest? So here you have 3 options. Copy is okay, but you can refine this question. So do you want to refine it for a certain age group, gender, geography? Then you can mention it here. So maybe, you want to do it for Indian patients. Anything else? Children? Right. So you refine it, and it'll generate again 15 versions, and 15 or whatever. It's not always 15, but so is this okay? The first one?
Second.
Survival rates and quality of life. So I'll do a match available literature. It gives me 4 options, of which databases you wanted to match against. For now, I'll just choose PubMed and try to match. Sometimes when it takes time, it gives us confidence. So you can see this here. So it'll give you some sorry. This thing is stuck. I'm waiting for this answer. So what it will do eventually, so you can, wherever it's saying found 1, found 10, you can collapse it and see which paper it found. But it also summarizes, which it will do once it's ready. It'll tell you the net answer, that this has been adequately addressed, this has not been adequately addressed, which is a good point for us to start with. It's difficult to say whether this is actually processing or stuck. So
Will this hallucinate references
Um, oh yeah, so this used up the credits, but this is unusual because it generally uses about 1500 credits every time you match literature. So matching literature is expensive compared to generating questions. So generating questions, it uses about 100 200 credits out of 10,000. That's not much, but matching literature is expensive, but it's not this expensive. So anyway, I won't be able to see this right now. Yeah, we'll have to move to the next one. So I'll show you research on. Sorry, I'll need my phone for that. So this is how research on looks like. You essentially start by creating a study here. So when I click on create study, study name is where you put in, let's say we do the same thing, CRRT versus PD in AKI. So you put your keywords here. These are fields which can be anything. So let's say 456. Study alias is CRRT AKI. Type of study would be research or anything. It can be single centric. I go next. My unique identifier is unique number. Consent required no. And I save it. Now when I click on this, it will start generating the study protocol. It will take maybe a couple of minutes. Not a couple of minutes, actually a few seconds. Research on .ai, research on .ai. So it started generating a basic protocol. Aim is to compare efficacy and safety. So we didn't say efficacy and safety, but that's the AI doing its job. Objectives: compare the rate of renal recovery between CRRT, evaluate incidence of complications, assess the impact on patient survival. Hypothesis that it will result in faster renal recovery but higher complication rates compared to PD. Study will be a prospective randomized control trial. Setting, population, so eligibility criteria is confirmed diagnosis of AKI, ability to provide informed consent. Exclusion criteria is this. Outcomes are so and so.
Research methodology workshop is not needed.
So
I think this would be the last research method.
some of these fields will be empty, which are for you to type, or you can use another AI tool to copy paste things here. It also starts with a abstract to start with. Yeah, so it starts with an abstract. It starts with an introduction. It starts with a rationale for this study. What are your aims and objectives, what patient recruitment strategies and so on. A very basic review of literature to begin with. So it starts, so this is just a beginning, but this gives you the dopamine kick which you need at the beginning, because now you've started. And so one good part is this. The second really interesting part here is the form builder. So when you will create a form to start recruiting, you can just click on generate here. So this uses AI to create a questionnaire for you.
Basically, no one has any excuses anymore. Not writing.
So it has created this. If I click on see more, so these are some questions it has created. So participant ID, age, gender, primary cause of AKI, comorbidities, baseline serum creatinine, baseline GFR, Apache 2 score, initial hemodynamic stability, urine output into rifle criteria, vasopressor use. Yeah, so you can select all and then maybe remove a couple if you need to. You add it to your form. And then here you can change them, but also each type has a different input type. So this is like a multiple choice. Some are multi-entry and so on. You can change the questions here. Now this is the pilot phase of your study where you are free to tinker with things. You're free to tinker with the questionnaire and all. In the pilot phase, you're allowed to take 25 entries. Entries are taken with the mobile phone, so it has an app companion where you do the data entry, which is great for the point of care where you're going to actually enter the data. When you're satisfied with the questionnaire and the study design, you move from pilot to active phase. After which you can't change the questionnaire, and after which you can't change the data also. So no data can be changed once you're in pilot, once you're in active. So this was a quick demo of research on.
Once you put it churns out the results.
So right now the analytics are here restricted to descriptive analytics. So it does not have statistical at this stage, but I'm sure they will add that soon. So.
The data goes on to an Excel sheet. Is it possible?
Yes. You can export the data. Yeah, whatever data is captured here can be exported. You can use it in SPSS, Excel, wherever you need
That would
to.
be the easiest part of the whole process.
For them, for AI, yeah.
Actually, you're saying you can just download this on a tab and just give it to every patient and ask them to just here.
Someone from the research team, not to a patient, but yeah. So your research team can do the data entry. Yeah. Finally, I'll just show a use case for a statistical analysis. So I have a dummy file here. So I have a dummy data file which I created for this. So I would just say, I'll copy the prompt actually. Can you and I did a very loose prompt. The prompt can be much better, but the idea was just to. So initially, it just describes the information that you have. Yeah. I want to compare differences in prevalence of hyperthyroidism across genders. Is it possible?
He understands abbreviations.
Yeah. Yeah.
Create tables and
Yeah. So it will do it. In the yeah. It,
It's already created a 2 by 2 to do the last crisis. This is a paid version or
Is it
the
replicable? I mean, reproducible, like you do it again the same thing.
yes. With data, yes. Yeah.
this is a paid version or
Mine is a paid version, but this will work on the free version. Yeah.
On the free version, it works once. Like it will analyze.
They have not specified what are the limits on a daily basis. So, but it works. These tools are getting more and more powerful. So, yeah.
It will answer your data question once. Like it will do one analysis and then.
No more than that. more than that.
No, actually it puts a limit to the amount of times you can upload a file.
Yeah.
That is the one.
And then it tells you to come back after.
Yeah, after
Yeah.
some
When
time.
you-
Yeah, and different tools have different. So Perplexity says that in a 4-hour window you can only do 10 questions. So they have all different rules, but just use it.
A different login ID if you,
Yes.
if you have
Yeah.
different email ID.
Correct. So, so there are more. There will be more Indian ChatGPT accounts than our population. So, right. So I think that was it.
Very nice.
Okay, sorry. I wanted to show you GPT-0. So GPT-0 is a tool where you can put in a block of text and it will tell you whether it was AI generated or not with very good accuracy. So
This
I've
is what journals used to see.
this or a version of it, yeah. So yeah, there are multiple tools, but GPT-0 is great. There's something called Turnitin. So Turnitin is there. No, it's just AI generation. So Turnitin is both, but GPT-0 is just AI. So this will just tell you if it's AI generated or not.
Any comments from the chat?
Yeah.
We have been commenting throughout the presentations. But brilliant presentation. Thank you so much. It was eye-opening.
Thank you. Just a quick word on Netflix. So the platform that I run, so it's a live learning platform for doctors. It has a section called AI Assist inside it. We have 3 use cases built in AI Assist right now. It's free to use. So the 3 use cases are differential diagnosis, drug interactions, and drug dosages. So you give it a drug name, patient type, whether pediatric, adult, pregnant, and you give it the condition for which you want that drug's dosages. So it will give you detailed drugs with references, and also drug interactions and also differential. So for differential, you can give it just 2 lines of history, or you can give it some investigations that you have, some sign symptoms. It'll give you a very good differential diagnosis.
How is it in
So
comparison to ChatGPT?
no, it uses ChatGPT. It uses ChatGPT at the back. So, but it takes away the effort of writing the prompt every time. So you just copy paste your thing. Yeah.
So is there any way we can safeguard against AI hallucinating?
You could build in some strength in the prompt you write. So you could emphasize that. So for example, you can say only refer to peer-reviewed journals with a high impact factor. Do not cross-check twice what you are saying. So that's the only way to make your prompt stronger and stronger. At the back end, on the technology side, they are fine-tuning it all the time. I mean, their number one priority is to prevent this. So they are building in guardrails to make sure that happens lesser and lesser. But I mean, beyond the prompt, there is nothing that we can do with it. So the prompt is your only tool. So the better the prompt you write.
Just on a lighter note, when will it start making PowerPoints?
It makes. Yeah, there was a tool that was on that slide called presentation.ai. There's something called beautiful.ai. There's something called gamma.app. But wherever image generation is concerned, the current AI tools are not good enough. So they are more of a theoretical inclusion in the conversation, but they're not good to use. Anyway, the value of a presentation is more in the content. So, the content will be there. Just put it on a black and white slide. It's okay. So.
I just wanted to add to what Dr. Weber was saying. So ChatGPT generates false references a lot of the time. So if you are, don't ask it for references is my view. If you,
So we should never ask ChatGPT to.
means the references that ChatGPT gives you, if you ask it to give you a text with references, many a times I found that if you actually go and search for them on Google Scholar or on PubMed, they will not exist.
But it's still better to ask for references and then check instead of not asking.
I mean, in my experience, most of them have been
So Perplexity is much better.
Complexity is much better.
Yeah.
How many AI tools are there like this now?
Tens of thousands. So, yeah. And ChatGPT has this thing called GPTs inside it. So GPTs are apps. So just like your Android phone has apps, so ChatGPT has apps. So when you go to ChatGPT, you can explore GPTs, and these GPTs are specific tools for a specific purpose. So for example, I've created a GPT called Homework Guru. So all you need to do is take your kid's, photograph. Let's say, so my daughter is in 5th standard. So her maths textbook, take the photograph of an exercise page and take 10 photographs of 10 different pages, and then say create a math paper for this. It's excellent. So and you can specify the difficulty level and so on. So these are mini apps. So that every time I don't have to write the whole prompt, because when I created it the first time, I gave it some instructions of what not to do, what to do. Like for example, don't include answers in your thing, and so on. So there are thousands of apps, GPTs now built. So inside just one tool called ChatGPT, there are 10,000 tools, and then there are many tools. So.
Just about that PowerPoint you can add these AI tools to PowerPoint and ask them to do it for you, and then they're just endless that. So if you can click just on say that's called as pilot in
Right, Copilot. Yeah.
in that, and it will just give you outline and context.
Sure. Yeah, that's right. Yeah. So Microsoft is because Microsoft has built Copilot and they have full access to OpenAI. So they are trying to build it more and more in your workflows. So inside Word, inside PowerPoint. But most of these I think will need a Office 365 subscription to work.
It is only
So
for Office 365.
yeah.
Office 365 is worth it actually. Only 3,000 rupees per year.
Yeah.
It's only 3,600 per year.
Okay.
Some version is free as well.
No. 1 month trial. Right. Thank you so much.